Infant is admitted to acute care with bronchiolitis. The infant experiences clinical deterioration requiring escalation of care due to undiagnosed congenital heart disease.
I'm ready for a report on Miss Stephanie Smith in room 10.
Fantastic. Stephanie Smith was an infant born normal spontaneous vaginal delivery at 40 weeks. Birth weight, 3.2 kilos. Pregnancy and delivery were uncomplicated. The baby's parents struggle financially, so they live with the baby's father's parents. Mom has a history of hypothyroidism and is actually a college student who's studying nursing. Infant received all routine well care and all of her vaccines. About 3 days ago, Mom realized that Stephanie was starting to have fevers, cough, runny nose, irritability, and decreased feeding. So she was referred to the ED after Mom had a telehealth visit with the family nurse practitioner because her breathing just didn't look right. Her mom reported that the infant was also fussy, spitting up every 3 to 4 hours. She's been breastfeeding about 10 minutes on each side, 3 to 4 hours as well. But Stephanie was just always sweaty when she was feeding.
Right.
She also reported the baby had soft, yellow, seedy stools 3 to 4 times a day, and sometimes Mom could see small, visible amounts of bright red blood. All of her vitals are in the computer. Do you have any questions?
I don't think so. Have a good morning.
Thank you so much.
Good morning, Miss Smith. My name's Jamie. I'm going to be Stephanie's nurse for today.
Hi, Jamie.
She's a tiny little thing. Ooh, and that's a nasty diaper rash. Have you been putting anything on that?
Just diaper cream.
Just diaper cream?
Yeah, it's been getting worse the past couple days since she's been sick.
I understand. I'm just going to take a listen to her, okay? See how her lungs sound.
All right.
How long has she been working this hard to breathe?
She always breathes hard like that when she's upset, but like I said, it's gotten a lot worse since she's been sick.
Since she's been sick. Alright, so we're definitely going to try and make her feel better.
Okay.
I'm just going to take a moment to look at her IVs and look at her admission order since she came from the ED, okay?
Okay, I'm just exhausted. I'm so worried about her.
Alright, I'm going to give the doctor a call. Her breathing does sound pretty harsh and she is working a little hard to breathe.
Okay.
Give me 1 moment, I'll be right back, okay?
All right, thanks so much, Jamie.
Hi, this is Dr. McDaniel. How can I help you?
Good morning, Dr. McDaniel. This is Jamie's from the PEDS unit. I'm just calling because we just admitted Miss Stephanie Smith, the 3-month-old with bronchiolitis from the Pediatric ED. I'm calling because she's had 3 days worth of cough, congestion, respiratory distress, and poor PO. Right now, when I did my assessment, her SATs have been sitting in the high 80s to low 90s, and I'm pretty concerned. Can you please come by and look at her? Also, I think I'll call respiratory therapy to come by to come see her.
Okay, sounds good. That's a good idea. In the meantime, can you also start her on 2 liters of nasal cannula? And I'll come by and see her shortly.
All right, perfect. Just to clarify, I'll start her on just 2 liters nasal cannula.
Perfect.
All right, thank you. We'll see you soon.
Okay, see you soon.
All right, bye.
Hello, Patrick from Respiratory.
Morning, Patrick. This is Jamie calling from the Pediatric unit. I'm calling about Miss Stephanie Smith. She's a 3-month-old that we just admitted from the ED with bronchiolitis into room 10. Right now her SATs are sitting in the upper 80s, so I'm going to start her on 2 liters. But can you come by and assess her?
Sure, Jamie, I'll stop by shortly.
All right, perfect. Thank you. See you soon.
Yep. Hello.
Hi, Patrick.
Hi, my name's Patrick, the respiratory therapist. I just wanted to come, how you doing? I just wanted to come check on her. I think she just started on oxygen.
Does she seem like she's doing better to you?
You know, SAT seem to be normal. Let me listen to her. Sounds good.
Okay, so are you saying that she needs oxygen now? Like, is she getting worse?
Yes, I think she still needs her oxygen.
Okay. Yeah.
So now that she's on the oxygen, you can look at our monitors and see that her stats are already coming up.
Okay.
So now she already looks like she's feeling a little bit better.
All right.
So why don't you just stay here and comfort her so she feels good?
Okay.
And then our physician should be coming by shortly.
All right. Thanks, Jeannie.
Hi, I'm Dr. McDaniel. Nice to meet you.
Hi, Dr. McDaniel. I'm Jen.
Her respiratory viral panel shows that she has 2 viruses.
Okay.
Looks like she's got RSV and adenovirus.
Okay.
Let me take a listen to her. I hear a holosystolic murmur at her left lower sternal border. Has anyone ever told you that she has a heart murmur?
Yes, we saw the cardiologist when she was born. They said she had a murmur, but they said she'd grow out of it.
Okay. Okay. Well, right now, a lot of different things could be contributing to how she looks, but we want to just make sure that we look at everything. So we'll go ahead and we'll get a chest x-ray, we'll get an EKG, and an echo.
It just seems like she's getting worse. You're doing so many things, but thank you.
Of course. Can I talk to you outside for a second?
Oh, definitely can.
When we talked on the phone earlier, I did not realize how much she was working to breathe. Does she look about the same now, or did she get worse?
Actually, this is kind of how she's been breathing the entirety of my shift. I'm sorry I didn't give you all the information on the phone.
No. I also could have asked about it, but I think specifically knowing about how deep her retractions were and how fast she was breathing and kind of how fussy and irritable she'd been would all been helpful information.
That's really good feedback. Thank you for letting me know so now I can give a better report in the future.
Great.
All right, thank you.
Retractions are a sign that an infant or child is working hard to breathe. What you will be able to visualize are spaces between the ribs or a sinking in appearance below or above the sternum or clavicles when the infant or child takes a breath in. The infant or child uses these accessory muscles to aid in labored breathing and compensate for respiratory distress.
Hi.
Hi.
I just wanted to check back in.
Okay.
So we're going to get a couple of additional tests, as I mentioned. So, there are so many different things that can cause murmurs. Some murmurs are what we call innocent murmurs, where we just hear the flow of the blood through the heart, and it's nothing that we need to do anything about, nothing to worry about.
Okay.
Some murmurs are what it sounds like your doctor had described to you when they first heard it, was that she'll probably grow out of this murmur when she gets bigger.
Okay.
But then there's a portion of murmurs that can cause babies to work harder to breathe, to sweat when they feed, as I know you had mentioned. So we want to make sure that we're not missing that type of murmur.
Okay.
So we'll get those couple of tests. We're going to get the chest x-ray, which lets us look at her lungs and the size of her heart. We'll get the EKG, which allows us to see how electrical rhythm is conducted throughout her heart, and then the echocardiogram, which is an ultrasound of her heart.
Okay.
None of these will cause her any pain.
Okay. All right, good.
A few hours later, RN responds to a pulse oximetry alarm at 88%.
Are you doing okay?
No, Jamie, she's getting worse. Are you going to do something for her?
Yeah, so it looks like she's now having some desaturations to the 80s, even though she's on those 2 liters.
Okay.
So I'm going to give the docs a page, but also call respiratory therapy to come by and see if she could get a treatment.
Okay. Okay. All right.
Post-nebulizer treatment.
Hey Patrick, how do you think she's doing?
Oh, yeah, Jimmy. I gave her a neb treatment and suctioned her. She sounds a little less coarse,
Okay.
but she's still tachypnic and having retractions.
Alright. Thank you for coming by and doing that treatment for me.
Yep.
Hey Jamie, how are things going?
Oh, hey Emily. I'm glad you came by.
I was talking to the charge nurse and she said you were taking care of a baby with RSV and respiratory distress.
Yeah. So this is Miss Stephanie. She's a 3-month-old with bronchiolitis. So she came in this morning, and when I did my assessment, she was breathing more in the 60s. But if you look at her now, she's more in the 80s. This morning we started her on 2 liters nasal cannula, which I still have her on right now. but her sats are dropping more into the 80s just being on this 2 liters of nasal cannula.
I see what you mean. She's breathing pretty hard.
Mm-hmm.
Do you mind if I take a quick look at her?
Yeah,
I
thank
think you
you.
raise the head of bag just going to help with her worker breathing.
Oh yeah, I can do that.
Is
Thank you.
Stephanie's mom?
I am. I'm getting really scared. I'm worried. She's getting worse.
Let me take a quick look at her. My name is Emily. I'm a clinical nurse specialist. I'm part of the leadership team here, and I work closely with the nurses like Jamie.
Okay.
I'm going to take a listen to her lungs and see if there's some things we can do to help Stephanie.
Thank you.
Alright, well, I'm going to listen to her. I hear some wheezing in her lung sounds, and I also hear a murmur. Jamie, is that consistent with your exam?
When the hospitalist did come by this morning, she did put in an order for an echo, an EKG, and also a chest x-ray. I think they've all been done except the chest x-ray. The other 2 are pending, but that does make sense. But you can see she really is working a lot harder to breathe now.
Yeah. What do you think we should do?
I am pretty concerned, and so is Mom, so I'd love your opinion on what to do next.
Yeah, I agree. I'm comfortable with her work of breathing, and I'm concerned that she can't continue to breathe like this without tiring out. I actually think we need to call our RRT and get the rest of the team here to take a look at Stephanie.
Oh,
All right.
please, help her.
I didn't think we were quite at that point yet, but I definitely do agree. I don't want her to tire out.
Yeah,
So
I
let's
think
call
it's
the
the right
rapid.
thing to do. So we're going to be calling for some additional team members to come take a look at Stephanie. There's
Okay.
going to be a lot of people who come into the room,
Okay.
but I'll be here with you and I'll tell you what they're discussing and what's going on.
Okay. Whatever you need to do, just help her, please.
All right.
Rapid response team called.
Hey guys, this is Stephanie Smith. She's our 3-month-old that I got out of the pediatric ED this morning. She's a 3-month-old bronchiolytic who is having increased respiratory distress. I have her on 2 liters nasal cannula, but she's still breathing in the 80s and her sats are sitting in the high 80s. Me and Mom were both concerned, so we decided to call the rapid response.
Thanks, Jamie. How long has she been breathing like this?
So when I got her this morning, she was breathing pretty hard. We did start her on the 2 liters. That did help for a little while, but over the past 30 minutes, it started to get a lot worse, so we decided to call it.
I'm just going to listen to her and check her IV. Maybe her IV doesn't seem to be working. Do you have the IV stock here?
I do have another. Let me grab it.
Thank you.
Here, Francis, here's a new one for you.
Thank you. I'll take this one here.
And have you seen whether or not her results have come back for her chest x-ray or her echo?
I know the echo results were still pending. I haven't seen chest x-ray yet. Do you want me to go and put that in as a stat now so they come by quicker?
Yeah, that'd be great. I'll take a look to see if her echoes has resulted. So it looks like she has a large VSD or ventricular septal defect. And the fact that she's been drinking, it sounds like pretty well today, and then also getting IV fluids, I'm worried that she's becoming fluid overloaded in her lungs. So why don't we give a 4 milligram IV push of Lasix right now. And then after we give her the Lasix, I'm just worried about how she's looking, and she's progressing. Looks like she's been getting worse and worse. So as soon as the PICU gets here, I'll make sure to sign out to the PICU team about what's been going on, and we'll get her to the intensive care unit.
Does she have a functioning IV access?
Yep, she has brand new access that Francis got for us.
Great. And are there any other medications infusing through it right now?
No, nothing at the moment.
Great. When I looked earlier, her renal function and her electrolytes looked okay. Here's the stat IV furosemide.
Thank you.
And I heard the request to give it IV push, but if we give it too quickly, it can cause hearing loss. So if the medication nurse can use the library and the infusion pump, we'll administer it over our standard 15 minutes.
All right, I can do that. Thank you.
Thank you.
So it sounds like we have some answers about what's going on with Stephanie and a plan to help her. The echo showed that she has a hole between the lower chambers of her heart. And now that she's sick with this respiratory virus, that's what's causing the difficulty breathing. To take the best care of her, we're going to transfer her to our intensive care unit, where we'll have really skilled nurses and respiratory therapists and doctors to work with her.
Okay, why am I just finding out she has a hole in her heart now?
Well, you know, sometimes holes like this don't cause any problems, but with Stephanie sick with the respiratory illness, that's why we're seeing it just now. When we transfer you to the intensive care unit, we'll have a cardiologist come talk to you, and they'll review all the images that they obtained in the echocardiogram, and they'll talk about things that we can do to make this better.
Am I going to be able to stay with her?
Absolutely. You can stay with her the entire time. There's a place that you can sleep, and you'll be in the room with her.
Okay.
Since hospitalization, the patient's respiratory issues have resolved. Workup team revealed ventricular septal defect in the heart needing repair. Interprofessional team meets with Ms. Smith to review discharge needs and answer questions. 5 days later, discharge planning rounds.
So Jen, in our bedside rounds today, we talked about Stephanie and how she's doing really well over the last couple of days. She's eating really well and her breathing has gotten much easier. So we pulled our team together and we'd like to talk about what it's going to look like for you guys to go home, because we think we're ready to start discussing that now.
That's really great news, but I'm just so worried. There's a lot going on.
That's why we're all here together. So I know you've met our social worker, Simone. We have Dr. McDaniels, the nurse, Jamie, and we have our pharmacist, Leanne. And we're going to talk about all those things that we need to do to get you home safely.
Okay.
Dr. Ling, our nurse practitioner that you know from home, is also with us, and she's going to be here by telehealth so that she can participate in this.